Let me talk about what COVID might mean internationally rather than nationally. I mean, we're all bombarded with new ideas about where we're going to be working, how we're going to be working, how we're going to be traveling, whether we're going to be traveling. But let me just focus on the question of what the COVID crisis, the COVID endemic might mean for the international scene. And let me tell you what I hope. I hope it demonstrates just how interdependent we are, just how interconnected we are. This is a theme of the late senators, a theme not just of our common humanity, but of economic and social and cultural ties across region and across religion, across the world, that bind people together. And COVID is the ultimate demonstration of how tightly we are tied together. And so my great hope is that while the first year of COVID has led to a resurgence of nationalism, of national focus, of local focus, I hope that as COVID becomes endemic, people think internationally, not just nationally, and there are signs of that. Today, to talk on the media about countries giving away vaccines is treated with less horror than it was 6 months ago, because people are realizing that the cliche, none of us are safe until all of us are safe, is a cliche because it's actually true. And so my great hope is that there is a building of internationalism. And the question then becomes, how does that turn from a hope into a reality? And here I want to make a specific pitch that we should, those of us who are internationalists, who want to see a stronger internationalism, need to recognize the importance of strengthening global public health institutions as a bridgehead to a new and stronger type of internationalism. I say that because public health is now in the public mind. It really shouldn't be hard to persuade a member of the public that you need strong international institutions to deal with an international disease or an internationally mobile disease. And the truth about America rejoining the World Health Organization is it needs an agenda to make for a stronger and more independent World Health Organization, because at the moment it's underpowered and not independent enough. More than 3/4 of its money it has to get with a begging bowl every year. It doesn't have a reliable stream of funding. And I'm sitting on the independent panel on pandemic preparedness and response, so I have to be slightly careful about what I say. Our final report's coming out on May, in the middle to the end of May. But I think that the bridgehead that needs to be established is that we need not just a multinational organization, we need a multi-sectoral organization that engages the private sector and civil society to have a global public health system, a pandemic preparedness and response system that is worthy of its name. And I hope that we can muster the political momentum for that. We've seen the dangers of denialism when it comes to the disease. And I hope we can muster the strength internationally to build a stronger public health pandemic preparedness and control system that has responsibilities as well as rights for nations, and ensures that we're able to protect each other because we depend on each other. And in this hopeful scenario, we would use the example of public health to make the case for the kind of robust, hard-headed internationalism that can take on issues of refugee flow that we deal with at the International Rescue Committee, issues also of impunity that we deal with, our staff killed in Ethiopia or in Syria, in acts of impunity for which there is no accountability or punishment. These are issues that go to the heart of the humanity and the internationalism of Senator McCain, and why I was so pleased to be asked by Cindy McCain to participate in the conference. It's not as good as coming to Sedona. I was lucky enough to be there 4 years ago, and there's something special about Arizona in April, May, and sitting in my wife's study in New York, I especially think of Arizona. But I hope those remarks speak to the theme of the conference, because never has it been more important to defend democracy.
Hello, everyone, and welcome to this panel, which is entitled Pandemics as a Global Challenge. My name's Hannah Vaughan-Jones. I'm so thrilled to be moderating this discussion on behalf of the McCain Institute. I'm in London, and I know many of you who are watching today may be on the other side of the Atlantic. But wherever you are, no one can have escaped the carnage, the disruption, and frankly, the grief, of course, of COVID-19, and that has engulfed the whole world, of course, over the last 18 months or so. And while vaccines are being rolled out in some countries to some people, we are by no means out of the woods. The suffering level, as you will all know, is still extremely high. And there is a very real threat of future pandemics, even as we face down this one. But we hope it's not all doom and gloom, and that we can return, of course, to some form of normality soon. So with me to discuss pandemics as a global challenge, we have two esteemed guests, Senator John Barrasso and also Dr. Tom Frieden. Dr. Frieden is the former director of the CDC and president and CEO of Resolve to Save Lives. And Senator Barrasso is the third ranking Republican in the Senate and chair of the Senate Republican Conference. He's also a physician, known, I believe, to many as Wyoming's doctor. So we have two doctors held in such high esteem with us today. Gentlemen, welcome. Thank you so much for your time.
Thanks for having us. Appreciate it.
Great to be with you.
Now, Senator, if I can come to you first and dive straight into the questions. There are many lessons that we will have learned from COVID-19, but what do you think is the most important one as global citizens and individual citizens as well? What's the biggest lesson that we've learned over the last 18 months?
Well, to me, it's human ingenuity. What we have been able to do in terms of the science and the research to have a vaccine, which they're going to make, 2 billion copies this year in less than a year from the pandemic arising. I mean, I'm one of these guys old enough to remember getting the Salt vaccine and how many years it took for that in the fight against polio. You take a look at something like HIV, AIDS, 40 years, still no vaccine. We have a vaccine for this that works, that's effective, mass produced in ways that are very different from anything that we've ever done before. And it's a commitment of a government entity putting lots of money into it and private research to be able to work together to come up with a solution to something in truly record time. I know for many people it feels like it's been a long time, but it is record time in terms of pandemics and in terms of emergency threats to the world.
And that's obviously a really positive thing that's come out of it. Dr. Frieden, would you agree that that's the main lesson that we've learned from COVID-19, the fact that vaccines can be produced at such a remarkably quick rate? Or is there perhaps something darker that's come out of this that we've learned about ourselves as individuals and as nations as well?
Well, I certainly agree with Senator Barrasso that this is a fantastic accomplishment. Not just the mRNA vaccines, but many others as well. And it shows what humanity can do when we use science and work together. But I think there is a more or a different lesson that I would also draw that's a little less positive, which is that we simply cannot afford to continue to be so woefully underprepared as we were this time around, both in the US and around the world. There is going to be a next time. There's no doubt about it. Nature is always throwing challenges our way. This one is a bad one, but it could have been worse. This is a virus that could have been even more contagious as measles or chickenpox is, and even more lethal as SARS and MERS and Ebola are. So bad as this is, and it's been horrific, it could have been worse. And to me, the most important lesson to learn, in addition to trusting science and relying on science to develop ways forward, is that we have to prepare better. And that means all over the world, we need early warning systems and rapid response systems so that when something does arise, because it will, we can stop it when and where it arises.
And Senator, if I can come to you on that point, the slightly more negative side of vaccine inequity, for example, one of the biggest problems when we're looking at future pandemics as well. I mean, do you think that vaccine inequity and the fact that it's the vaccine producing countries and the richer countries that are getting access to vaccines, that is our reality at the moment, that needs to change when we're looking to 5, 10 years, however far down the line the next pandemic might be on the way?
Well, you're in a situation here in Great Britain right now has just been cut off from the European Union in terms of vaccines. So it's not even necessarily rich and poor. It's a matter of redistributing or distributing precious commodities that need some time to be produced, even though they are being produced at record periods of time. You know, President Biden just this past week essentially said America first for the US vaccine, very similar to what President Trump had said. They did it in a little different words, but it's the same implication. We want to help people around the world, but not until absolutely every American who wants to be vaccinated can be vaccinated. You see with the vaccines now around the world, China is trying to become a hero by trying to make vaccines available to folks who might be later in line to get the vaccines. So politics always is in play, as well as science, trying to come to a proper balance in a world with 7 billion people, and we can make 2 billion vaccines in a year. We're still at a record pace for getting the pandemic behind us. And I agree with what Tom had to say in terms of preparedness. And there have been supply chain problems in America, different places around the world. You know, people say, why don't we just have all of basically the protective devices stored and on shelves in the hospitals? You know, as a doctor, I know that the gowns and the gloves and the things we use, they have a shelf life. They're not good forever. So it's a matter of what resources you put into keeping all of those supplies on tap immediately. There's a lot of lessons. We could spend the next hour on just the lessons that we've learned from this, and to get to the point we are now. I think it's remarkable that we are where we are 1 year afterward, in spite of absolutely the death and the isolation and the suffering, the human toll that this has taken. There are tolls from the disease, and then the secondary tolls of some of the shutdowns and things that's happened in society. But people are turning out to get the vaccines now. Certainly in Wyoming, I was at 2 clinics in this past week where we have communities coming together, people lining up in school gymnasiums and civic centers, and even an old military armory to get the vaccines. People want this vaccine.
You mentioned, sir, there about politics and science, and which one is perhaps leading the race, or if they're just running concurrently next to each other. I mean, do you think that the response so far under both administrations, the Trump administration and the Biden administration, has it been led more by politics than by science? Well,
you know, it's a very interesting. I was reading a book on Churchill, and it said during World War II, he had his scientists always involved. He said, I have my scientists on tap, but not on top. That he wasn't going to let science dictate. He was going to see what's in the best interest of everyone. And I think some of the concerns that I've seen, certainly in my home state of Wyoming and around the country, is sometimes the treatment can be worse than the disease itself. And one of the nurses I talked to yesterday, a public health nurse, she said, look, we have vulnerable communities. We haven't been able, because of the lockdowns, haven't been able to do prenatal care treatments. We haven't been able to do birthing clinics. We haven't been able to get to see some risk families for over a year. We've had a meeting of all the Wyoming doctors on a Zoom call. We had heard from the pediatricians who were concerned with lockdowns and people out of school. This was late last year, saying, you know, we're not sure the kids are getting proper nutrition, mental health concerns, suicide, abuse of substances, spouse abuse, child abuse, all of the things that came because we were so focused on the pandemic and coronavirus that it sometimes took such a priority over other community and social needs that you have to decide what is just the pure science of this disease versus what is the best interest of society as a whole.
And Dr. Frieden, what are your thoughts on that? Because you obviously will be working across lots of other medical conditions as well and diseases. I mean, do you think that COVID has taken too much of a priority perhaps, and that other things have fallen by the wayside and other people have suffered as a result of this focus on the coronavirus?
Actually, one of the things that we've recommended from my organization for more than a year is to really balance the interests, to make clear that when you're making a recommendation, there is a science-based recommendation and there's also a community decision. And as long as that decision is made openly with a clear understanding of the criteria, we think that's a very good process. Now, in that, I think we have to be clear about a few things. First, it's been clear for some time, and we've been clear on this for a year, that schools are relatively safe, and that in most circumstances, schools with safety measures in place should stay open. We know there are definite harms to closing schools, harms not only educationally, but socially and health-wise, and in many other ways, economically as well. We also know that there are lots of things that can be done safely. So out of doors is great. What I do wish is that we could agree on a few things. Let's agree to vaccinate as quickly as we can and address equity in vaccination better than we have. And I'd like to get back to that in a minute with your earlier question on vaccine nationalism. But second, let's agree on masks, at least indoors, when we're near others who are not near our, who are not in our household. Masks really do work. And I understand that some people find them intrusive or offensive, but really the main freedom that a mask inhibits is the freedom of the virus to spread and kill people. And the more we mask up, the more we can open up our economy. Now, there are real risks here with variants and rapid spread. So it's not as if all of the interests can be easily balanced, but we know that the better we control the virus, the better we can recover our economy.
Now, you're obviously both physicians, so I'm not at all surprised that you're encouraging mask wearing, but it does raise, you mentioned personal freedoms there, and it raises an interesting point, doesn't it? Because so many people have said that the edicts and the rules coming down from federal government, state government, and the world over as well, all governments, of saying social distancing and homeschooling and mask wearing, et cetera, it's an infringement on my personal freedom. And do you think that that's where government can overstep, that it needs to, that sort of messaging needs to come from community first rather than, say, federal government? The question to you, Senator, first.
Well, a number of things. I'm in a state, we're independent, resilient, self-reliant group. This is the Rocky Mountain West, Wyoming. We are much more likely to listen to local than to national, but there's also been a global loss of respect for authority generally, whether it's the press, whether it's elected officials across the board. And perhaps this is the internet age in which we live, where there's such an opportunity to have polarizing opinions and to undermine what would normally be respected and accepted opinions. But we have over the recent years, and you do polling on this, who do you look for? What institutions do you respect? And it is less and less and less. I think if you hear from a local nurse, a local healthcare provider, that works much better than it does from the national level. But I was just saying with Tom on the call, for all the years that I've read orthopedic literature, before that, the New England Journal of Medicine, Lancet, I could never have imagined that in 1 week last summer, both Lancet and the New England Journal would retract published scientific information, where the New York Times has a headline story. I pulled this for this. The headline in the New York Times: 2 huge COVID-19 studies are retracted after scientists sound alarms. I mean, to think that things have gotten into the New England Journal or Lancet that then had to be retracted, both with regard to coronavirus. One had to do with hydroxychloroquine, the other had to do with ACE inhibitors. I mean, different things. It was based on the same study. That it's not surprising that the public says, well, wait a second, what's really going on here? Who can I look to as an authority, as somebody I trust? And as we know from studies, people are much more likely to look for advice to people either like themselves, people that they know, their Facebook friends, more so than they are to look to some national authority figure.
Yeah, Dr. Frieden, your thoughts on that, on just the attack on personal freedoms, or if it is indeed an attack on personal freedoms, and also the age of misinformation that we're currently living through, and who can people trust? Yeah,
there's a lot there to think about. I think the first thing is, there's an old saying that your right to swing your fist ends at my nose. And I think we have to think about that when we think about what is appropriate for government action. If you're working in a grocery store and there's no mask mandate in your town, and somebody comes in without a mask and you're vulnerable and you haven't been vaccinated yet, that's really not fair. There's no reason that person should put your health at risk. And that's your job. You have to go there in order to be able to make money to put food on the table for your family. So mask mandates work. They increase mask use. Now, on the issue of closures, it's much more complicated. And here I think each community should have an open process for deciding what they're going to do. We might say, based on some standard principles, that, we really think at that level of spread, you shouldn't have restaurants and bars open. But ultimately, that's, I believe, a community decision. I'll give you an example from another part of the world. The South African government has had a pretty good response to the COVID epidemic, to the pandemic. And they said a few months back, the disease is still spreading, but people are starving, people can't get to work, and so we're going to reopen because in this case, the cure really is worse than the disease. There's so much TB, malaria, HIV, not malaria, but TB and HIV not being treated in South Africa. So I think it is up to the community to make that kind of determination, as long as it's done openly and hopefully it's done rationally, because we do see countries around the world where it's not done rationally, and that results in a lot of avoidable suffering and death. In terms of authority, I think this is the way of the world. And as studies get produced faster, you see mistakes like the retractions you saw that Senator Barrasso mentioned. I think what this emphasizes to me is that for those of us who are in science, we need to be very clear about what we know, when we know it, how we know it, what we don't know, and what we're doing to try to find it out. So we're not saying we know more than we do. And frankly, one of the things that's been frustrating to me during the pandemic is you have a lot of instant experts who are suddenly popping up on TV all the time, but have actually never worked on infectious disease outbreaks, but are very good for the media. And I think that's been unfortunate, because we sometimes are kind of chasing the latest trend rather than thinking very clearly about what do we need to do and how do we stay together to control this? Because really, fundamentally, it's humans against the virus. The only enemy here is a microbe.
Well, you mentioned about if we're talking about world leaders and who's responsible for spreading the correct message and the correct information, you're both, I mean, Senator, if I can ask you to sort of take your political hat off for a second and just have your doctor hat on, your physician hat on. Do you, as physicians, both of you think that it is the duty, the right, and the responsibility of world leaders to bolster science at times like this, especially in the face of vaccine conspiracy theories?
Well, a couple of things. One is we're still learning a lot about coronavirus. Here we are a year into it, and we're still learning new things. The experts have made a number of assumptions from what we knew at the time, and we were wrong. I mean, people were wiping down Amazon boxes, didn't want to pick up a pizza, wiping down a pizza box, and because I think we thought that contact spread was going to be a lot more than it really is. I think we were wrong in terms of not realizing how many asymptomatic people might be holding the vaccine and spreading it. We weren't sure about tests, about treatment, the efforts that went into more respirators. And then by the time Prime Minister, you talk about national and international leaders, Boris Johnson came down with the disease and was in the hospital, they did everything possible, even having him in an intensive care unit, trying to avoid putting him on a respirator, avoid intubation, because at the time, if you went on with an intubation and a respirator, the chances of surviving were less than 20%. So we've learned a lot, and the public is having a hard time following, keeping up, as scientists are just trying to learn the newest and the best. So much was made about contact tracing. But and I think, Tom, you were quoted in the Economist last week about the fact that because of some delays at the CDC, this was after your time there, that we were delayed about a month in the testing. And by the time we were able to truly look about contact tracing, we could have done it early, but by then there were too many positives and the tests weren't available to see who was positive. So there were more cases every day than we would have ever had the capacity to contact trace, which you might do in some other kind of a more slowly spreading or earlier gotten to pandemic. So we're still learning an awful lot, and I think it's sometimes hard for the people who aren't focused on this every day in the public, people who are just trying to kind of get on with their lives and dealing with their kids on Zoom schooling and those sorts of things, to follow as we do the up-to-the-date medical things, and what was true last week may not be true this week. It's just hard for the public to stay completely up on that, I believe.
But it seems like you're kind of like trying to let the politicians off the hook a bit in a way by saying, well, you know, we're just following the science and the science is developing all the time. But shouldn't there be a point, or should there be a point when politicians say, you know what you know, but we have to do what we have to do, and we're gonna, you know, the buck ends with us basically, and that we have to take responsibility for this as world leaders? Well,
we absolutely did in the Senate. 96. We have 100 members of the United States Senate. We voted 96-0 on the CARES Act. which put tons of money into this Operation Warp Speed, said, work on vaccines. We will commit as a nation to buy hundreds of millions of doses of the vaccine. Please make it, do everything you can, drop other things, go focus on that. And the reason it passed only 96-0 instead of 100-0, because 4 of the members weren't able to vote because they were either were impacted by coronavirus, either by having the disease or being under quarantine. So in terms of making the big brush strokes of this is what the nation needs to do, we need to be on the footing for war against this disease. We need a vaccine. Working with the experts, they said the best thing we can do is get a vaccine. That commitment was totally there, and it was bipartisan. In terms of something like a mask mandate or schools open or closed, you want to make sure the schools have the resources. Wyoming schools opened last August. They've been in school for the entire year. I was in 2 schools yesterday. We have places around the country where schools haven't opened yet. So those shouldn't be top-down decisions. Those should be local decisions.
And of course, you mentioned there about vaccines and the rollout of vaccines and buying vaccines, et cetera. And Dr. Frieden, I know you wanted to sort of talk more about vaccine nationalism and the question that I mentioned earlier on in our discussion. I mean, do you think that vaccine nationalism is inevitable? And if it is, I mean, is it always a bad thing? I mean, actually, could it be the case that competition between countries is a good thing in terms of speeding up the science?
Competition can be a good thing, but not in this case.
Okay.
Albert Einstein said that nationalism is the measles of mankind. It's an infantile disease. Now, pride in your country is one thing, and pride in the positive traditions is wonderful. But what we're seeing here is very concerning. I do think that vaccine nationalism is inevitable, but I also think it's ethically inexcusable and it's epidemiologically perilous. Because anywhere there's uncontrolled spread, you can get the emergence of variants that are more dangerous, variants that spread more readily, variants that kill more readily, and variants that might overcome even the best of our vaccines. We're not seeing that yet. So far, the vaccines that we have seem to work well against the variants, but the variants really are the wild card. This pandemic will not be over for the United States until it's over everywhere. And I do think there's a way forward on this. It's not simple, but it's possible. As Senator Barrasso said, the mRNA technology is stunning. The vaccines are very effective. And what you've essentially done is taken a somewhat cumbersome or very cumbersome biological process, and you've transformed it into a chemical process that's not easy, but much more predictable. And the companies are getting better and better at doing it. But the production is nowhere near what's needed for global control. And that's why I think what would be most beneficial to the world and to the US would be to expand mRNA production capacity in different regions of the world, control it so that it's not a commercial risk to the companies that have invested in this, but use new production facilities to get these vaccines, which can readily be tweaked if new variants emerge and which are much less susceptible to production delays and problems, to help us get past this pandemic for good globally.
And I'm going to come back to that point specifically about vaccine manufacturing elsewhere in the world. But Senator, if I can first ask you about vaccine nationalism just as a concept in and of itself, do you agree with Dr. Frieden that it's inevitable, but it's not a good thing?
Well, I say it's inevitable. We can discuss whether it's a good thing or not, but this is the reality of the world in which we live. I mean, Bloomberg has a story that I pulled just from 2 days ago. Biden uses Trump's America First vaccine plan to corner market. So you have 2 people that had very different opinions, President Trump and President Biden, throughout the last year. We heard about it during the presidential campaign. They told the story very differently. But when it came to the vaccines, they have the identical America First vaccine plan to corner the market, as reported just a few days ago. So I think this is human nature. This is the way it is going to likely to be. But I think that Tom is absolutely right. The ability to produce at a rapid pace is going to have this behind us in much shorter way than it would have been if we're looking at other kinds of vaccines that required rhesus monkeys and vats of eggs for different kinds of different things and kidneys to grow vaccines. Now we have an ability to identify and produce very, very quickly.
So when we're talking about vaccine inequity and the idea of bolstering vaccine manufacturing outside of the US, Europe, China, India, where would you go first, and how quickly do you think that this sort of system could be up and running in time for either the next variants of COVID-19 or indeed the next pandemic?
Well, you'd have to go to countries that have stringent regulatory authority so that you can have confidence in the quality of the vaccine. You have to go to a country that's willing to say that they're not going to take it for them first. Maybe they'll take 20% of the production, but they're going to let 80% go regionally. And there are a number of countries in Asia and Africa that meet those criteria. The most optimistic estimates is that you could probably have production up in 6 months or less if you had collaboration from the companies. So it's the kind of thing that has to be done in a collaborative way.
But I'm interested that you said that it would have to be countries that say that they'll take 20%, but they'll give 80% regionally to the wider continent, for example, of Africa. But why should they do it when America and the UK and other countries in Europe and in India and China, when they don't? Well,
the idea would be that it would be a bargain, that the bargain would be they would be given funding and the technical know-how, and the tit for tat really is that now they've got to produce something that's a global good. The alternative is to do it in a really small country. And then even if they use all for themselves, they have a small population, so it's not going to affect the total supply much.
Okay. I want to move away just for a second from the science, because I'm not a doctor and I will get washed away in it all if I get too deep in with you two, I think. But I want to talk a bit more about the politics, perhaps. And I'm wondering, Senator, if I can ask you what you think that the COVID-19 pandemic has revealed to us about the importance of international leadership.
Well, I think that international leadership should be a key role, and we started on such a bad foot with the World Health Organization and with China trying to at first deny and still withhold information. I'm talking to the researchers and national institutes in Washington, specifically, that we were told months and months later that they were still having a hard time getting the sort of information that they needed. And even the Wall Street Journal just this week had an article, an editorial about, they call it the Wuhan whitewash, about the fact that we still don't know. And that report that just came out a year later after the coronavirus came into the world was seen as much more of a political document than a medical or scientific document. So you say, is there a need for global leadership on this? Yes, but who does one trust? Who does one look to? And at what other level do you look to those people when you know that they may not be trustworthy on other items? Just a couple of months prior to coronavirus, I was with Cindy McCain, and we were in Halifax at an international security conference that John McCain regularly went to, since we're at the McCain Institute, and they were giving the McCain Award, and they were giving it to some of these freedom fighters and resistors from Hong Kong. And they came and told us the story of what was happening to them under the Chinese Communist Party. Well, it's the same party who is in charge where Wuhan exists. You can discuss what they did right, what they did wrong, but there has been a history of bad behavior coming out of that. And now you say, okay, what about the World Health Organization? If they're trying to get out information, how trustworthy are they? I've had concerns about them from back in Ebola. Watched how the elections work there. That's much more of a political and lobbying process than it is based on the knowledge of medicine and next breakthroughs and watching pandemics. So I don't think that there is right now globally an international organization that commands this sort of respect that one would look to as an authority figure. And to try to deal with that and get to that level, we're clearly not there yet with the World Health Organization.
But if you leave organizations to one side and you look at nation states instead and think of international leadership from individual countries, then presumably that international leadership should come from countries that are producing vaccines as well, that are taking the lead in trying to combat this virus. And that would include China, that would include Russia, that would include India. So are you saying that you would you be happy if the Chinese or indeed the Russians decided that they wanted to take the lead on a global stage in combating this pandemic?
Well, we know what we did in the United States with coming up in record time, Operation Warp Speed, with vaccines that are highly, highly effective. And we know that from the testing that is done. We now have 3. We have a couple that are 2 doses, another a 1 dose. Effectiveness much higher than any of us could have ever hoped or wished or dreamed. Doesn't mean other countries aren't going to try to do that. We know that China is doing that, and their model is to let's get this to nations who will then become our friends, places that might be lower on the list of when they would get the vaccines if they can get it to China. It's kind of like what they're doing with their Belt and Road Initiative. This is, I believe, from a standpoint of the Chinese Communist Party, much more of a political operation than a humanitarian operation. They're in the process of working for influence, in my opinion. And I see the United States in terms of trying to come up with a vaccine that will clearly work, and will be used first in the United States, but will be then shared and spread around the world as quickly as it can be produced.
But I suppose, sorry to just go on this point a bit, but I suppose I'm interested in the idea that China may well be kind of trying to gain influence in other continents and other countries that are poorer than they are, and they can spread their vaccine there more easily, and that will win them favors. But everyone benefits from that. I mean, that poorer country benefits because its citizens are vaccinated. So has the US missed a trick on this, in that saying it's America first and we're going to vaccinate our own citizens first and everyone else is a secondary issue? You lose influence and therefore you lose power and on the international stage.
Well, I don't think that's the case. I think that that our leadership in actually coming up with a vaccine that is this effective shows America ingenuity and opportunity and investment. We're going to make a difference worldwide for other folks. I'm not sure what China is in the process of doing right now, but this is a forum with the McCain Institute on democracy, and I do know the standpoint of what's happening in China in terms of how they steal trade secrets and how they oppress people, they bully. They are a nation which I would not want in no way is representative of democracy, which I believe is the best long-term approach globally. And that's why we continue with the McCain Institute and institutes like that to try to produce a better understanding around the world and more democracy shared worldwide as opposed to an authoritarian communist regime.
Sure.
Hannah,
Tom,
if I may,
go ahead. Yeah, please do.
If we look back to public health history, health can often be a bridge to peace. At the height of the Cold War, the United States and the then Soviet Union collaborated to end smallpox forever, saving hundreds of millions of lives. During the 1980s, when presidents and leaders all around the world committed to childhood vaccination, wars were literally put on hold so that children could be vaccinated. So it is possible to use health as a bridge for peace and understanding. I think when it comes to global organizations, we need WHO and we need for them to be stronger. And I agree with Senator Barrasso that the way their leaders are selected is too political. The way their human resources work is too political. They have functioned much better during COVID than they did during the 2014 to 2016 Ebola epidemic. There's no question about that. And there are a lot of very dedicated expert people there, including a lot of American scientists who work hard to protect people. But even with a more effective World Health Organization, we're going to need more globally. This lack of preparedness that I spoke about at the very beginning is going to require a long-term commitment to building the early warning and rapid response systems around the world. It's probably going to cost at least $5 or $10 billion a year, every year, just for the lower income countries for at least a decade. And that money is not going to go through the World Health Organization, the Global Fund, which Congress has funded in the latest iteration, and COVAX, which is a major commitment by the US to vaccines, are examples of what can be done. But we're suggesting a very clear way of measuring progress. We're calling it 717, that every single country and every single community should be able to identify a suspected outbreak within 7 days, report it within 1 day, and implement effective control measures within 7 more days. Right now, very few places around the world are doing that or even measuring it. And by having that kind of a galvanizing target and understanding the world has to be better prepared, I think we can make a huge difference in driving down the risk everywhere.
And Dr. Frieden, I think you've just answered my last question to both of you, which is essentially what measures would you put in place now in order to prevent the next pandemic from happening, or combat it at least once it does hit us? Senator Barrasso, if I can come to you then, just to close out this panel and put that question to you. What would you do either within the Senate or within your state of Wyoming to try and prevent the next pandemic from being as hard hitting as COVID-19 has been for us all?
Clearly, it's early understanding, early recognition. Some of the things that we didn't have this time, probably because of the area where it began in China. But I think, Dr. Frieden is right in terms of what we can be doing. In this last, we did 5 bipartisan bills related to coronavirus. In the effort that we passed in December, we had $4 billion of U.S. commitment to that COVAX program, 100 million doses expected in March and April. Now, I understand there have been delays because of some increased demand for vaccines and some problems with the manufacturing process, but the United States has committed the resources. And we have done that legislatively in a bipartisan way, and this was signed by President Trump. The resources have been committed so that people around the world can get the vaccines much, much more quickly than they would have ever been able to get that had it not been for both American ingenuity and the inventiveness of the researchers, and then the commitment to produce and ship around the world. So I think in terms of the next pandemic, we're better prepared with a vaccine, but need to be prepared with an early warning. And I think supply chains are also very important. We didn't really get much into that, but the United States and some of the things we're talking about need to be better prepared from a supply chain and not be dependent on other sources around the world for critical minerals, medicines, supplies that we in a global economy routinely relied on others for. And I think that there's going to be, in preparation for a new epidemic or pandemic, we want to be prepared to, if we need to go it alone, we'd rather do it globally.
Well, it's the what and the how. The what, I think, is stronger public health systems in the US and global, stronger primary healthcare systems, because our primary healthcare system is too weak, and stronger resilience at the individual and community level with better health. And the way that's going to happen is only if we fix this cycle of boom and bust, panic and neglect. Every time there's a health emergency, there's a lot of money, and then it goes away and the programs go away also. And the way to fix that is what we're calling a health defense operations budget designation that would allow Congress to have oversight of very specific budget lines for our health defense. That's an approach that takes it out of the budget wars, both partisan and fiscal, and says the health of our people, the security and safety of our people come first, and we're going to have a transparent way of knowing what's needed and whether we're funding it. And so that kind of approach is needed to break this cycle of panic and neglect, so we have the stronger public health, healthcare, and community resilience that we need to be better protected in the future.
Well, I can tell you both that from the rest of the world, I mean, I'm in the UK, we're all, very grateful to science, to scientists, and also to American ingenuity for the speed at which vaccines have been produced and rolled out. And we're hugely grateful to the likes of you both as well, our 2 doctors on this panel today. So to Senator Barrasso and also to Dr. Frieden, my thanks to you both. I'm very, very grateful for you joining us for this panel, Pandemics as a Global Challenge. And I'm sure I can express the thanks of the McCain Institute as well to you both for joining us. Thank you both.
Thanks, Hannah.